My name is Amanda Johns and I'm a certified nurse midwife. Certified nurse midwives are kind of like nurse practitioners. We are all trained as nurses first, and we've all gone back to school to seek higher credentials with an emphasis and focus on pregnancy care. So we offer full scope reproductive health care basically from someone's first period to the last period of menopause, and we have a big passion for the pregnancy aspect of that. Growing up, I kind of always knew that I wanted to be involved in healthcare in some way. I think a lot of people who enter this field just kind of had natural caregiving tendencies with a great interest in the science part of it. How I got into midwifery specifically is I knew I wanted to do women's healthcare in some aspect, but I didn't really know how. And then I saw my first baby be born, and that was it. That was the moment that I said, oh, this is what I want to do for the rest of my life. I'm originally from Georgia, born and raised and trained down there. My husband's job brought us here to Colorado, and I've been here for the last 3 years now. I've got a 3-year-old and a 7-month-old, so that is where a majority of my outside of work time is spent. But we are pretty active now living in Colorado, as everyone is, hiking, biking, going camping, finding whatever the new latest romantasy book is. I will be reading that. And gardening is now a new passion of mine. Having my own children and going through my own birth experiences has made a really big impact on how I interact with my clients, the different recommendations I can do, just how I relate to them on a more personal level of knowing what their experiences are and having lived that in my own way. My philosophy of care really centers around education and empowerment. I am here to offer you education and give you options. You get to decide what you want to do with that information and how you want your care to proceed.